Okay, so time being 6 o'clock, I'd like to call the Abington Board of Health meeting to order. Um, our first item on our agenda tonight is an Eagle project update from Nicholas Schultz. So, Nick, would you like to give us an update?
Yes. If, as you remember, you may remember, my Eagle project was having a group of speakers presenting about emergency preparedness at the school. After a long time of thinking it over, I've decided that due to the fact that my 18th birthday is coming up rather quickly, which is the deadline, and all of the things with the coronavirus, I was thinking of changing the medium in which I give those.
Okay. So, what were you thinking of doing?
My plan was making a series of videos where I go over the topics that I would have gone over at the presentation and posting them onto YouTube on on Abington Cam's channel, and I would be recording and editing those with the help of Abington Cam.
And you spoke to them about that?
Yes, I did.
Okay. What about the materials and binder that you were going to provide the health department?
I will still provide those because I still do have the resources that I'm going to be using. They're the same ones that I was using for the speaking.
Okay. Is that acceptable to everybody? Marty, I think you're the actual the listed beneficiary on the project. So, um,
I mean, it is a very apropos subject, if we're being honest, right? And if it helps in any way get us prepared to better deliver the corona vaccine, then it is a massive win.
excellent. All right. Anybody have any questions for Nick? Yeah, you're getting off easy, kid. All right. So I believe the next process is you have to check back with your district advancement chair to make sure those changes are okay, and then just update us when you've got some stuff recorded.
Mm-hmm.
Okay. Well,
Thanks.
sorry.
Thank you.
All right. Thank you, Nick. Okay. Next item on our agenda is our favorite time, the COVID-19 update. So, what do you have for us, Marty?
I don't know. Has anybody? I don't know if anybody's been able to check the website since about 1700, 16, 4:30, 5 o'clock tonight. As of that time, we have about 98 cases pending. 98 cases in isolation. Excuse me. Of almost 614 total, and approximately 200 residents in quarantine based on a contact with a positive case. I believe the numbers in the neighborhood of 140 out just at the schools. I know it is a significant number of coming off of that this evening, and some are also going on. This is a very challenging time. The numbers of contacts is approximately 200 because we've just based on the workload, we've had to send a few of the cases to the CTC because just can't keep up with all of the positive cases right now. It's been a real struggle, and I don't anticipate it getting much better anytime soon. The state has reported over 5,000 cases for the last 4 days in a row. Today, I think we had a reprieve of about 2,500. But we'll see going into next week or this whole week and the week after that, and then leading into Christmas. It's been a real struggle. So, and it's frustrating when you see people not wearing masks and hear of people having large gatherings and gatherings with family who aren't in the same house. And we are having to talk to people who have been intubated and whose families are experiencing real pain from this. So I will again ask everyone to take this seriously. Wear your mask. Do not gather outside your home with people that you don't gather with every day. Don't live inside your home. And And to do watching your distance and all that too, we also made the recommendation earlier this last week to limit the number of people in all of our public buildings as much as humanly possible. We know that it's difficult because bills still have to be paid, construction things still have to go on, but it is just a method to try to limit personal interactions. And the library, which I firmly believe is the model for safety for libraries in Massachusetts, also went to curbside pickup only. And I know that is a real service, that is a real burden to the librarians because they really pride themselves on top-notch service over there. And the Council on Aging is they're still doing everything they have to, but they're also limiting interpersonal contacts as much as possible too. Yeah, this is a very trying week since the holidays, so please everybody wear your masks, wash your hands, stay inside, and don't gather. The one thing that we're having a problem with right now that's leading to the spike in cases is family spread, and people going to parties, going to gatherings with people they don't normally hang out with. If one person gets it and is symptomatic, they're going to pass it on. And I feel like a broken record here, but if you've been asked to quarantine or isolate, please do so. It limits the spread. You can't give it to your friends and neighbors. Remember, it might not affect you. You might be able to brush it off like a cold. No big deal. But not everybody's that lucky. Some people have really bad problems and they'll have long-term lasting effects. So be a good neighbor and try to do a little bit better for, sorry. That was work. Be a better neighbor and help.
We got another one.
So a number of people have been asking about testing sites on our Facebook page today. We just posted a link to the state's directory of testing sites. There are 4 within a 5-mile radius of Abington.
Website also has a list of all of them. And if you're having problems getting in, please let us know and we will do our best to help you out. On that note, the state released new guidance today at about 1:30-ish that changes the timeline for quarantine exposures. It's readily available on the mass.gov website. We will put a link to it on ours tomorrow. But the bare bones breakdown is that someone can get a test on day 5 of quarantine. And then if it is negative, they can exit quarantine after day 7. So technically on day 8. So my example is if your last day of exposure was on the 1st of December, you can get a test on the 6th of December. And if it's negative and you've had no symptoms and you continue monitoring yourself for symptoms for all the way out to 14 days, you can exit quarantine on the 8th day, which would be, on this example, December 9th. Now, if for some reason you don't want to get a test, you have to stay in quarantine for 10 days if you actively self-monitor and you've had no symptoms, or 14 days if for some reason you can't do those things. Again, it is a massive change. We will post it on the website. And if you have further questions, give us a call. Is it retroactive to the people that are currently in quarantine? Great question. Call the office and we will try to sort it out and help you out with that. We just started a constant contact where we can send out information to the community via a constant contact similar to the schools. So sometime this week, we will be sending out a sign up for that. So if you sign up for our constant contact, you will get notifications from the board and from the health department of COVID updates, and hopefully in a post-COVID world, whatever healthy living class we're doing sometime in the future. I think that's the only COVID update I have. I'm sure something will, jog in my memory as we start getting into it. But
yep,
those are the big points that I wanted to talk about tonight.
All right, excellent. Next item on our agenda is.
Just did it.
You got to hear the words. That's all it takes.
COVID vaccine. I wanted to briefly touch on this. I have no idea. And that is just the honest truth of when we're going to get it, who's going to get it first, or how it's going to be distributed. There is a webinar with the state on Wednesday morning that hopefully I will know more after that. So we know it's coming. Um, we know it will help. But even if you do get the vaccine and you're one of the first among us that gets the vaccine, and that's really good and that's awesome, and you're very lucky, please do so. That does not alleviate the responsibility of wearing a mask and washing your hands and being a good neighbor. You still have to do that until the vast majority of us get the vaccine. So be patient, even after vaccine development. A few vaccines do not mean we all get to go to the Garden for the Celtics games. So be patient, please. I'm begging you. No more gatherings, please.
We have an excuse to stay home and be antisocial. Take advantage of it. So speaking of vaccines, sorry.
Oh, I do have a quick question for you, Marty. And like obviously like off the cuff, so don't feel like I'm going to hold you to this as far as data. But on the large gatherings, is it kind of related to the holiday season, or are we still seeing like a certain age group demographic that tends to be more susceptible to that than others?
Yes to both.
Okay.
We have been told of that were gatherings of a younger, more resilient crowd, we'll call it, and also the time frame still fits for the holiday. We're not too far removed from it for that holiday weekend, especially, to have been in the realm of possibilities. I hope that answers the question.
Thank you, sir.
Yes, ma'am.
So on the subject of vaccines, our next agenda item is flu vaccine update. So where are we with flu vaccines?
The state still has a mandate, and we still have some vaccines left over. It is really difficult for us to hold a vaccine clinic right now because there is only one nurse in my office that can give a flu vaccine. So we will do our best to accommodate, and hopefully we will get at least one more clinic in before the Christmas break. But at this point, I hope everyone has made arrangements at least to have their children vaccinated to meet the new state requirement, or talked to your pediatricians about exactly what the plan is after that. But with the current caseload, it is nigh impossible for us to hold several flu clinics as much as we would love to do a lot of that, because that's fun. You get to talk to people and stab people, which is always cool.
All right. And the last item on our agenda, sorry, this is all you, Marty,
I know.
is discussion of moving the health department to the Frollo.
So the more I think about this, the more I'm on the fence. So I wanted the board to kind of weigh in. It would be a service increase in the amount of space that we could have, and we would have classroom capabilities because they have the space over there than their actual classrooms, right? So in a post-COVID world, we can actually do food service training for our restaurants. We can do quit smoking courses for our residents. We can do Alice or whoever wants to do the opioid meetings can have, things like we can do educational programs, which are, my 20,000 foot view of the health department is that we are offering more than just what we've been offering in the past. It is more service opportunities, more, live strong, cholesterol, those kind of things, maybe even a workout here or there, whatever the case may be, health related. And there's more space. Some of the downside is it would be on the second floor where the handicap accessibility would be an issue. They could only come up to the first floor for those people who have mobility issues that wouldn't be able to get all the way up to the second floor where our actual office is. So there's a lot of good and a lot of not so good, but not terrible. And this is, I understand that this is maybe a bit more removed from right now, but I did want to start everyone's thinking process and kind of gauge, would it be an actual service increase? because I wouldn't want to do it unless it's an actual service increase and not, not just because there's more space. And there's also a lot of ideas about having the health department in the same building with the other permitting bodies, right? So it's a one-stop shop in town hall versus, you'd have to go back and forth if we were at the bigger location in Frollo. So I didn't, obviously I wasn't anticipating any kind of decision being made tonight. It was more of just this is what I was thinking to potentially long-term have a service increase. Now we do have the Cotter room in town hall, but that we would just have to be very careful about our scheduling of courses and things like that up there. So that's a viewpoint, is that I would like to have, like to offer more to the community, because I'm a community health worker. I'm sure you guys all know that. I'd like to be able to offer more health and wellness programs to the community, especially after we all get the vaccine and we're
We're healthy.
out more and actually have a class.
Well, I would think if part of the thought process is having a classroom available, having a space where you could store and keep teaching aids and equipment rather than having to pack it up and put it into an already tight space in between is worth consideration.
It is, yeah, I agree.
And
But
we know how hard it is for our board to find a boardroom under normal conditions, let alone trying to add anything to that schedule.
yeah, and this also brings into the move. It would be only sustainable if there's service increases. So I keep saying that because that's the driving force. I think if services are going to stay the same, then we would just stay where we're at, and maybe if we ever get an approval for a public safety building, we'll move into that. But these are all long-term projects that just so the board knows that it's not all we're doing is COVID. I mean,
It's nice to look up every now and then and look a little ways down the road. And
yeah, and that's really all I got on that. I just wanted to make sure the board is aware of the strategic thinking behind those things and are aware of my 20,000 foot view of this.
mm-hmm.
Marty, is there enough room in the potential new space to do like flu clinics in there, or is it too small for that?
There would be enough room. Yeah,
that would justify service, because you want to kind of go where the people are sometimes. I get that, but in a pinch, you now have a dedicated space to run a flu vaccination clinic if you ever need it. So that's pretty.
The Frollo gym, which has the basketball court.
Yeah.
So in between patients, we can play horse.
Whatever helps us stay healthy and moving.
Yeah, exactly.
And it's a pretty accessible site.
I do worry about the accessibility. That would be my only, questionable. That's my only concern.
Does the Frollo, because I know being a student there, this was years ago, there was there was a lift that kind of went up around the stairs by the gym side. Is that still there, or?
It is, but it doesn't go all the way to the second floor, which is the rooms that would be available to us.
Okay.
We'll only go to the first floor. So anybody with accessibility issues, you'd have to make other arrangements, like meeting them on the first floor, or meeting them, in the parking lot. I don't know what it would be, but these are all those are the things that I worry about the most, because, if we're doing something that's supposed to be a service increase, it has to be a service increase for everybody, not just the lucky few that can walk up the stairs.
Yes.
I will say, I think one of the things you mentioned about being concerned as to the one-stop shop kind of idea, I do think we do a lot more than just permitting and fees and such that would justify that. So I wouldn't let that be a deterrent.
Yes, and if I'll just piggyback on that real quick, is we are moving towards electronic permitting, so that also could free up some of that as well. And that's it.
And thank you, Marty. I like the idea of maybe perhaps doing some courses or anything pertaining to opioids and addiction. I know I was talking about it earlier last year, but working on a project with a few people in town, trying to get some programs going and stuff like that. But as we all know, COVID-19 has put a hold on many things. But thank you. That's awesome.
I would like to do a lot of courses.
Yeah, I like the idea. Any other questions or discussions on that, guys? All right, well, we don't have anything else on the agenda. I did want to take a minute to thank Alex for risking life and limb this past Saturday to keep the compost site open despite the inclement weather. You said, I think you posted you had like 75 people come down.
Yeah, we have close to about 100. We got at the post it was 75, but we got almost about 100. It was impressive to see how many people came out. And I also I know it was definitely a difficult year with COVID-19 and everything, but I'm so thankful that we got to keep the compost site open and the volunteers coming by and helping out the several weekends that they did and months that they did. And thank you to everybody wearing masks and keeping your social distance and all that. Thank you, Chris, and thank you, Marty.
Thank you for doing that. Thanks to our volunteers too, because we didn't know if we were going to be open for some of the weekends, so I had to ask them to save their Saturday for me, and then tell them that we were going to be closed. You know what I mean? Like it's a hard ask for a lot of people. So they're good people, and if you're looking to volunteer next year when it's open again, please let us know. We will happily.
Oh, absolutely. We got a porta potty now, which is great. Thank you, Marty.
Hopefully we'll have a few more things next year.
Yeah, no, and I mean, it was kind of really awful weather on Saturday, but I'm glad we got to keep it open. I thought, especially we never know when the leaves are going to fall. Some years might be different than others. So I'm so glad we got to keep it open. I mean, and with the horrible year we've had, I was going to make the effort to make sure that it was going to be open for the last time. So
Thank you for that.
oh, no problem. Thank you.
All right. If there isn't anything else, I would gladly take a motion to adjourn.
I'll make the motion.
Do I have a second?
I'll second. Oh,
All right.
Chris
all,
Nate can second.
all in favor of adjourning, say aye.
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 All right. Thank you, everyone. Stay safe. Wear your masks. Wash your hands. Stay home.